Well, here with Dr. Martin, a dentist in Pontiac, in Michigan. Pontiac, where they make the car, he told me. Where they used to make the car, that Pontiac. Now, Dr. Martin, hi.
Hi.
Dr. Martin, tell us, when it comes to dentistry, especially when it comes to missing teeth, lots of us people have sometimes a missing tooth or two or three missing for quite a while. Usually in the back, because, when we get a missing in the front, we run to a dentist rather fast and replace them because it's ugly. But in the back, sometimes they're missing for a while. And yet every dentist like you keeps telling us we really got to replace those teeth because they create havoc if they're not there. And yet we have them missing, and seemingly it looks like not much bad things are happening. Can you shed some light on this, of what's going on there? What's the controversy? What are we missing here as patients?
Well, usually you end up having, your teeth are really not as functional. You can't really chew your food as well. And then it also contributes to your teeth shifting, which can create problems in terms of causing deterioration of your bite, and also gum disease. I mean, it's going to contribute to all those things.
I see. So when you say the teeth shifting, basically what you say is the teeth, because there's a missing tooth, a little bit like in a fence ball. When you have lots of fences ball and you have one missing, they start all of a sudden going really wobbly and they shift around. And and then one tooth misses, kind of like moves the other tooth, and a whole lots of teeth start being crooked.
Yeah, they start working against each other a lot of times.
I see. By working against each other, what do you mean by that?
Well, if they shift, sometimes when they shift, they end up hitting one tooth, or maybe two, three, may end up actually hitting another tooth differently and causing you to contact differently, which can create problems with your joints. It can cause problems with food being packed in between your teeth, and then also cause problems with excessive wear on your teeth.
I see. So when you say problems with the joints, so that makes a lot of sense to me from kind of like an engineering viewpoint. So if all of a sudden, your hinges don't work together anymore because a few teeth are missing, and then you're using maybe one more than the other one, so you wear out one hinge more, plus the teeth get crooked and they keep missing each other. It's like cogwheels out of alignment.
Exactly.
So you create tension. Let me ask you, since you mentioned that, is it possible that when you have missing teeth, but that, things, as you said, the joints and all kinds of stuff get out of alignment, does that bring tension to your neck and have maybe stiff neck, stiff shoulders, and maybe even headache as the tensions goes up there? Can that have anything to do with it?
Exactly. And basically that's muscular, muscular incompatibilities with the way your teeth hit together. So if your muscles are not coordinated with your bite, then depending upon where you concentrate your attention, as you say, it could actually be manifested with your tooth being sore. It could be manifested with certain muscles, like the muscles that you open and close with. It may bring tension to that area. It may bring tension to your joints, where you feel like an earache or possibly even a headache with muscles that go up and through there. Basically, it's just that the muscles are not really coordinated well, and that will bring on other problems.
So it looks like that some of the other problems, because if there's, obviously if you ever had, which I'm sure most of us at one point or another did have, but so if people have it for a long time, if they have sore neck muscles, shoulder muscles, and headaches, that's quite a kind of deed to live with. It's very unpleasant to live with that. So never mind the food chewing, which is in itself, I'm sure, lots of problem. But for instance, I chew fast, period. When I sit with my wife down, she has her first bite, and I'm finished with the steak. And so, it wouldn't do me any good to have very bad. I know. But the point is, lots of people think like that. You know what I mean? They don't chew anyway. They go, right. But so if you don't care about the food being chewed right, or if you don't care about food being stuck in it, which has its own problem, the tension it can create here, that can definitely inhibit your ability to work, your ability to sleep, and just basic pleasure. So a person who has those type of things, especially if he has teeth missing, and if he has kind of neck pains, shoulder pains, and headaches, would it be wise for him to check out a dentist and see what's going on?
Oh, definitely. That at least eliminate that as a potential, as the source of your problem. And usually that's where most individuals start, is with their teeth. And most people are not aware of that. A lot of times when I do an exam, I'll ask the question, do you grind? Do you clench? Do you have muscle soreness? And a lot of them will say no, but I never knew that teeth were related to that. And they end up finding out that that can contribute a lot of problems when your teeth are not in harmony with each other.
Well, again, makes a lot of sense. I mean, look, as we speak here, how much your mouth is moving. So if because of your teeth it is moving out of alignment, very obviously all the muscles next to it are going to get very heavily affected. So what you're saying is a person can come in and he gets it fixed based on his teeth, or at least he gets it eliminated and can continue to look for other reasons why he might have those tensions.
Right.
Well, thanks a lot, Dr. Martin. That was quite informative. I'm sure people listening to this video will, get something out of it, and maybe go to a dentist. And it's really quite amazing. You have headaches, you have shoulder pains. Go and see a dentist. I'm very sure that most people don't look at it that far-fetched, and yet we all know that wherever the pain is isn't necessarily where it's caused. So we have a headache. It's not necessarily a deficiency of Tylenol. It just could be a deficiency of a few teeth.
Correct.
Thanks a lot, Dr. Martin.
Okay, thank you.